Good day, everyone. We are very happy to have you join us for a webinar called Back to School Medicaid Mingle. I love the name. This is going to be fun. This is going to be informative. And I'm very grateful to have Dr. Millward and Steve Ireland with us. Dr. Millward is Executive Director for NAME, and Steve Ireland is the President for NAME. My name is Jeremy Glauser. I'm the CEO and founder of eLuma, who is hosting and sponsoring the webinar today. We are so glad to have you. If you could take us 2 slides forward, let's talk about the agenda and what to expect. After a short intro, we'll turn it over to Dr. Millward and Steve Ireland to present on Medicaid and the state of things. We'll also have time for Q&A at the end of the webinar. So please make sure that you use the chat to ask questions. Down at the bottom of Zoom, you'll see an icon that looks like a chat box. Click on that, it will open up the window, and please enter in your questions there. We'll keep track of them and we'll make sure to have a great conversation. We also want to remind you that the closed captioning is an option. So at the bottom of Zoom, again, if you move your mouse, there is an icon for closed captioning. Turn that on and you'll also get text over the voice. Now, I want to, if we can advance the next slide, please. I want to talk to you a little bit about eLuma and let you know that it really is our objective to help students achieve their potential. And this is one of the ways that we hope to do that, by creating community and an opportunity for all of us to learn together from experts, to ask questions, and to have an important conversation. So come follow us on Twitter or Facebook, find out more resources, connect with experts and professionals in the field. We really, truly do want to partner and bring good solutions to kids all across schools in this country. I want to tell you about a promotion that we're doing as well. If you could advance to the next slide, please, that would be great. We're going to donate $50 to NAMI, the National Alliance on Mental Health, for every consultation that we have with you. You can use the link that's on your screen, eLuma.com/mental-health-consultation, or pull out your phone right now, open up your camera, point it at that QR code there, and tap the link that you get. It will take you to a page to schedule. We really do believe in the work that's being done, and we want to help move that forward and encourage you to have a conversation with us about partnering in the community and in our districts. Let's advance to the next slide, please. And I want to talk about this webinar series. Today, as I said, we're going to be talking about Back to School Medicaid Mingle with Jenny Millward and Steve Ireland. We also have a webinar on December 7th where I will have the pleasure to present. This webinar series is very much focused on education and special education, many topics within that umbrella. Go to our eLuma.com/webinars page. You'll see where you can go back and view previous webinars, get resources. You can also register for future webinars. In addition to this special education series, we have a mental health and MTSS webinar series that you can register for and learn a lot more about. And last but not least, I want to introduce our wonderful guest today. So if you can advance to that next slide. We have Dr. Jenny Millward, who I've known for a number of years and have had the pleasure to get to know and work with, and am very impressed by what she's doing now and excited about what she's doing now, as well as Steve Ireland joining us, the president of NAME. So let's talk a little bit about their backgrounds. Dr. Millward is an award-winning special educator who has served in Georgia for 29 years. Wonderful career. That's a lot of good years, Jenny, including administrative roles of program specialist and director of student services at Houston County. Her district became the first district in Georgia to fully implement the Aspire initiative for student-led IEPs. Held the position of GCASE, legislative chair and co-chair, as well as the state advisory panel representative. For those of you who aren't familiar with CASE, it's the Council of Administrators of Special Education. It's a wonderful organization, and Georgia's unit is so strong, much of which I know is because of the leadership that comes out of that state. Jenny continues to advocate for children with disabilities, currently as the executive director for NAME, the National Alliance for Medicaid and Education. Welcome, we're so glad to have you and can't wait to learn from you. And then we've got Steve Ireland, served as 2022 NAME president and NAME Region 2 state Medicaid representative since 2015. Has managed cost-based reimbursement for school-based services since 2009. A lot of great experience. We're excited to hear from that and learn from that, Steve. Directed cost-based reimbursement for public health departments since 2007, and has guided hospital rate setting of inpatient and outpatient care, special financing reimbursement, tax supporting Medicaid. Additional rate setting activities have included ambulatory surgical centers, rural health clinics, federally qualified health clinics, and other facility types since 1996. I think it's safe to assume that we've got a lot of good knowledge here, and we can't wait to learn from you. We look forward to a Q&A after your presentation. So one last plug, put your questions in the chat and we'll revisit those. Dr. Millward and Steve, take us away.
Thanks so much, Jeremy, for that warm welcome. We are thrilled to have had the opportunity to spend some time with eLuma and friends of eLuma today. We're grateful for this opportunity and look forward to sharing with you so much information that's out right now with Medicaid. So that was a sweet introduction, but I also want to acknowledge those who aren't with us that may have registered for the webinar that might have been in the path of Ian. And we hate that you weren't able to join us, and our thoughts are with you. We certainly want to extend our gratitude, though, again to eLuma for having us today. So let's get started about Medicaid and the impact that it has on schools. We have 37 million students in the United States served under the Medicaid program. This makes Medicaid the third largest funding stream for public schools. It is a significant force. And if you're not already billing Medicaid, it's something your school district really needs to consider. It began in 1988 with mostly just special education reimbursement options. And just more recently in 2014, we had the expansion into free care. The important things to note with these stats are, even though we're doing a great job and we have 37 million students that are eligible for the program and receive these benefits, we still estimate that there are more than 2 million students that do not have Medicaid coverage that are eligible for this service. The services have been that have been able to be supported in the educational setting are invaluable. Many studies have been conducted to confirm that healthy children have better success and participation in schools. One study was recently referred to in the CMS bulletin that was released in August, and it talked about Medicaid enrolled students having better attendance at school, better academic outcomes, even high school and college graduates coming out of that at a greater rate, earning more as adults. With the majority of our nation's children that attend public schools, we certainly can see that this provides an effective and efficient way to provide support. Health equity is vital, and especially in the formative years. So while 37 million children enrolled is wonderful, there are still over 2 million children that we would love to see benefit from these services. I wanted to share with you a little bit about NAME and who we are. This is our, you can see our vision statement. We envision the day when public policy promotes student health and wellness as essential to learning, and I'm sure you agree with that. We have over 415 members in the National Alliance for Medicaid and Education, and we have members from school districts all across the nation. We have members from state-level Medicaid and education agencies who are involved in the administration of Medicaid claiming for school-based services. Membership also includes those with an interest in Medicaid and education fields, such as vendors, consulting firms, other nonprofit organizations, and federal agencies. Our federal partners are vital, and we're going to talk more about them in a little bit. Our organization has been supporting professionals in the field for over 20 years. And we have been able to hold 17 national conferences on site and one that was virtual. You can see our map and that we're divided into 3 regions. We have also LEA and SEA representatives from each region that serve on our board. You can see again that our vision statement has so much to do with our work because we want successful academic outcomes from our students. A little more about our organization. This is our mission statement. Several key words here, including collaboration, integrity, and growth. Collaboration was the reason we were formed. There was not a table for all partners to sit and discuss best practices, barriers, or needs. Integrity is certainly also critical. Have you ever been audited? So this is a safe space to openly discuss audits, things like that, and how to improve. The important thing to remember here is not to get too nervous. I've been reassured over and over that no one has ever been convicted of fraud in this program. But of course, errors occur, and we want to help minimize their occurrence. Lastly, let's talk about growth. That's key to today's conversation. The new bill that was passed this summer is all about growth, supporting it and expecting it. We will talk more about that bill a little later. All right, so this is just a spot check here. I don't want anyone to feel overwhelmed yet. We're all at different stages and places with Medicaid implementation. Even though the program began, like I referenced earlier, in 1988, just this year, the final and 50th state joined this program. So that's what I mean by saying we're all in a different place with the implementation. And on top of that, every state does things a little differently as well. But we can all learn from each other and support each other as we try new things. These are some questions that may be in your mind. If you're new, we have an academy that supports that at our upcoming conference. Are you worried about what to expect with an upcoming audit? Well, we have a friend that you can talk to. Free care is still new to many states, and we will address that in a little bit as well. And the big topic of the day is that final question, the BSCA, and you may not even know what that stands for. That stands for the Bipartisan Safer Communities Act. It was just passed on June 25th of this year, so it's relatively new. It's incredible. It's a $750 million funding stream that we're going to talk more about and take a deeper dive into what that means for you as an educator. It's incredible, and it's sure to provide us with many more resources. And again, more on that topic to come, but I wanted to hook you up with that because it's really the hot topic of the day. So to finish talking about NAME, I wanted you to know what our goals are. So of course, we all operate on goals, and NAME is no different. These are our goals, and I hope you will want to be a part of us. And as we work towards them, I'm sure there's something that you can also contribute to the conversation. So facilitating networking, like I mentioned, we have people from every area that touches Medicaid, whether federal, state, local, or a professional. Also, we love to share information that's pertinent to our work. Building and maintaining those relationships are foundational to NAME. And then, of course, our annual conference, where we get to meet and share best practices, trends, and issues. Our conference is coming up in just a few weeks, and we're really excited that eLuma is going to have a group with us. It's going to have a lot of information about the bill and also from a variety of these partners. So if you're brand new, or you might be from a state that has recently adopted it, or you could be in a county or a school district that hasn't or is just starting or really doesn't have a lot of experience, I kind of just wanted to simplify the process and talk about how it works. This is certainly simplified. There's much more to it, many more details, but just a basic way of how Medicaid unfolds. But certainly we all begin with the end in mind. If you want to peek at number 5, that's really what it's all about, reducing the burden locally. reducing the burden on the local taxpayer or the local school district, because we know that it's all about many questions are answered based on budget. And so let's go through the rest of the steps. First of all, states are not required to participate in either of the programs, but we are so excited to be able to finally say this year that all 50 states do participate. Of course, not all states are participating in the full offering of Medicaid, and I'm going to give you some insight to that in a little bit. But a lot of times people don't understand about the money, and simply put, it is a federal and state partnership, and states do match those funds. But CMS does reimburse for the portion of what is billed for school-based services. And the more services that a state allows in their SPA, which is a new word I had to learn, which is your programming, and so the more services the states build into their plan, and it allows more dollars to be reimbursed federally. What I keep hearing from Washington is that many dollars are being left unclaimed. Every time I have a conversation with someone from DC, they do reference how much money is left on the table and left unclaimed. We heard it again this summer at the Special Education Legislative Summit. And the federal agencies are very, very much wanting all of us to take advantage of what is being offered, of what is out there. And so that's why they're changing some things. And that's why they created a new bill for us. And they're going to be giving us some more support that we're going to be talking about. Steve, I know this area is an area that you're really strong in. Is there anything you'd like to add to this simplified description of the working of Medicaid?
Just simply put, every state, Jenny mentioned it earlier, every state has a unique program, and we're not, I don't think, there's a little saying that says, if you've seen one Medicaid program, you've seen one Medicaid program. That is true, that everybody has their unique way in being governments. We like to do it our specific way and don't always look at others, but there is a lot of elements that cross across our boundaries. CMS encourages us to go a certain way. And if you pay attention and collaborate with everybody within your state and across from other states to get the knowledge about it, there are ways to expand. For instance, there are some states that are still working on a fee schedule based model where they submit the claim to get paid on the claim and everything's hunky-dory. The problem is CMS has encouraged cost-based reimbursement, and there's a lot more money that's available going cost-based versus the fee schedule-based. And that's the type of information that people need to hear, that, and participating with AIM and other organizations like us gets the word out that there are means. And we talk about them at our conference, we talk about them at face-to-face and with our networking to help assist each other with tools. None of us are experts, none of us are perfect, but working together, we can find a solution to continue to expand, which is our step 5. In order to expand, get more money to the grassroots where the services are actually rendered.
Thank you. So he did mention about expanding. This is a map that talks about the expansion of Medicaid. I partner oftentimes with Healthy Students Promising Futures. They're a great resource if you aren't familiar with them. And we are really thankful to be able to collaborate with them so often. But again, this is an expansion to free care that can be seen here. CMS recently reported that 17 states have now joined free care. Free care states are those depicted here in gray. So that you can have that for a reference. And since most states are not free care states, I thought examples might help you so that you can have a better idea of what free care is all about. And I borrowed these examples from the recent informational bulletin from CMS. For example, a qualified Medicaid enrolled audiologist that comes into the school and provides hearing assessments for the entire student body can now bill Medicaid for those services, whether or not other third-party payers are also billed for the hearing assessment. So, in other words, this this now expands to students who are not based just on an IEP. This is for all students. So an audiology screener that is done school-wide can now be billed for any student who is eligible, whether they have an IEP or not. Another example is if a school nurse facilitates a fluoride treatment to the entire student body, so long as that nurse or the school is enrolled as a Medicaid provider, the fluoride treatment could be eligible for Medicaid payment. So these are a lot more options that are now available to schools for reimbursement that weren't previously available. And so we're going to talk a little bit more about those. Some states have not taken the opportunity to incorporate these services in their Medicaid program. It is not required that the states enroll, but the act that I mentioned earlier, the Bipartisan Safer Communities Act, has added a significant amount of money, significant amount of funding, which is about $750 million that they have added to be accessed through this type of reimbursement program. Federal officials have told me on a number of occasions that they would like to see additional dollars distributed and that they have a new plan to help with that. So again, depicted on this slide, the gray states have either already expanded to free care or they're in the process of adding it to their current Medicaid program. We have a few states who have just submitted their application for that, but the blue states have not taken any steps towards their free care expansion yet. And so we're certainly hoping that as more states become aware of the funding stream that is available through free care, that they would take advantage of it. Steve, do you have anything to add for free care?
The way I think about the free care expansion is once CMS did that letter that they named it free care actually, that enabled all the states, anybody to expand beyond the special ed services. We were restricted to special ed prior to that point. And having them lift that restriction is what enabled everybody to expand it. And it's not a huge deal to expand as much as it is teaching and encouraging and communicating the availability and then putting it in your state plan in order to do it.
So this is what I've been promising a discussion on, and this is the most talked about item in our world right now. It's really exciting. It's called the Bipartisan Safer Communities Act, or the BSCA for short. As I mentioned earlier, it was just passed on June 25th. It was incredible to see how fast both sides of the aisle came together to make this happen. It is largely in response to trauma that has occurred in schools and due to the sharp rise of mental health needs of children, particularly during the time of the pandemic and since. Let's take a more in-depth look at the features that make this bill so unique. The first item, updated guidance. This is quite significant because the Medicaid guidance for our implementation in schools has not been updated in nearly 20 years. If you want to go back that far, I was still using like chalk and a chalkboard. I might have gotten my first classroom computer. I don't know. I mean, it's unbelievable when you really consider what has transpired across 20 years and how much has changed in the world and how we deliver services and how we support children. And this impact that this updated guidance can have is really exciting. We are working and having conversations constantly with OSERS and CMS as they collaborate on updating this guidance. We would love to have your voice join ours. And so I really would encourage you to consider joining us and following us as this information rolls out. So since this guidance hasn't been updated in nearly 20 years, this has caused a lot of conversations across different sectors. Vendors, schools, states, each have specific changes that they would like to see happen. And this is certainly the time to plant all those seeds and to communicate any concerns that you have had with the Medicaid implementation and what you would like to see change. But NAME is a great resource that CMS turns to when they have needs or questions, and we're happy to support the process. We are anticipating that this guidance will be released early next year, hopefully before spring. You can see that a significant amount of money has been set aside for specific things. So in all, they want to help address school-based mental health needs, the path to get there with staffing. They have a lot of smaller things that they've incorporated into the entire pool. There are going to be grants for states to apply for. I encourage you to watch for details. Those details have not yet been released. We're waiting for those. But you can see that they're going to launch a technical assistance center, and that will be specifically for implementing, enhancing, or expanding the provision of Medicaid assistance through school-based entities under Medicaid. You see staffing shortages mentioned here. Another significant sum is set aside for that. My current understanding of that is through this program, they're going to expand service repayable grants and expand the Pell Grant to graduate programs in related fields such as school psychology or school social work. The hope is to attract and diversify the workforce in those shortage areas. Now, next we see telehealth and where that comes in. Finally, Jeremy might say that there's a federal push for telehealth and its place in school-based services. We are really excited to see this. Jeremy mentioned that we had partnered previously, and I certainly can see the value of telehealth in schools and how it helps engage students, helps with staffing shortage, so many different ways. And so I'm thankful to have about 15 years experience with telehealth in schools. And so I was so glad and thankful to see this mentioned, not just in the bill itself, but directly mentioned multiple times throughout the guidance bulletins that CMS released. So certainly the federal government is encouraging states to rely on telehealth as a solution to staffing shortages and to address the needs of children in school. Finally, the recent release of 2 informational bulletins that were mid-August. One bulletin was specifically titled Information on School-Based Medicaid, Funding, Documenting, and Expanding Services. They were released the 18th of August, and they were meant to serve as a sort of back-to-school guidance in the form of a checklist. I'm going to show it to you in just a minute. In this document, they did explain what we should be working on. They want states to be working on easing the administrative burden on providers. I know as a director how important that was. The burden on a provider to do excessive documentation is certainly something that the federal government is encouraging states to look at. They want it to be easier. They want to promote participation. They want to increase access. And they feel like the key to that is to relieve some of the administrative burden. So I know that sounds good to all my listeners here. CMS also stated that the bulletin is just one of the several steps they're going to take to support access to Medicaid school-based services. So we look forward to hearing more from them and knowing what else they have in mind to support you. They're encouraging schools to include Medicaid enrollment in the registration process. You can certainly see why that would be so valuable. With so many students still not under the program, they would love for schools to help with that during registration time. They also referenced, of course, the TA Center, the Technical Assistance Center that they're going to be opening, and that will open in the summer. They are very focused on whole child care. And again, it is emphasized in the bulletin that states are encouraged to facilitate telehealth to deliver them. This bill directs CMS to provide this additional guidance, and there will be more information to come. There will be many CMS presentations at our upcoming conference, and we are highly anticipating the messages. because this act is so large, if you go to the bill itself, it can be very overwhelming to read. I wanted to share with you some resources that I have given and directed our membership to make it easier to talk about, make it easier to understand, because the language and just the volume that bills often come in can be overwhelming. So I have a hyperlink here to a one-pager that was created that really talks about what the bill means, and you break it down into our terms. But it does create, you see first, it's really about crisis intervention in states. So $750 million funding pot in all. It does have an element to protections for domestic violence. There's some training for first responders, which I know will also be valuable for schools, because if your first responders are better trained, that's going to in turn help your communities and a crisis that may happen at your school. You can see that there is additional funding for mental health, community clinics, school-based clinics, telehealth. All this is part of it. Training for pediatric providers to identify mental health needs. So it's so appropriate that we're talking about mental health needs while eLuma is supporting NAMI, which is another great resource in the community for mental health needs. But specifically, you can see built into this bill, support after traumatic events. I know we all have recognized there have been a number of traumatic events that have happened in schools. And so this is another response to that. You may have noticed recently in this summer, the push for the National Suicide Prevention Lifeline that has taken that 1-800 number down to a 3-digit number. That was part of this bill. And then, of course, finally, the last page of it is the part about schools, school-based mental health for staff, the training pipeline, the conditions. There's also a pot of money in this bill specifically to help with school climate, after school programs that they hope to see in the form of community learning centers. And I feel like that's probably the portion that states will see grant applications come out of. We'll await that guidance. We haven't received it yet. And then lastly, school safety. And so you can see that they were very, very much wanting to support schools and to help with the mental health needs that you see. I may have made a mistake with my browser. Let's see if I can get back to our presentation. My apologies. I have another hyperlink. I referenced several times the information bulletins. So CMS released 2 information bulletins mid-August. And like I said, I wanted to share those with you. Here's one of them. This is the one that was specifically cited for school-based services. It was meant to serve as a checklist in coming back to school for you to review, school districts, for the state education agencies to review, so that you can get ready for what else is to come. You can see that this was released from the Deputy Administrator and Director of CMS and CHIP Services, Dr. Dan Tsai. He will be our keynote welcome opening speaker on Tuesday of our conference. We're thrilled to be able to have him joining us. And he has been a significant force behind this work, and we're so excited to continue our partnership with him. This document will help you understand also more about what the bill is expecting them to do. It has a number of, it's a pretty lengthy document of 19 pages, but there are several little checklist portions that I think would be valuable for you. I'm going to show you, I'd love to show you where to find those through our NAME website, because I do have those listed for our members, which is a great part of being a member of NAME. So that's when I wanted to talk to you a little bit more about NAME and what it's all about. So of course, we do have a great website that has events listed, specifically our upcoming conference. So many resources, like the one I was just able to I was just able to share with y'all. The one pager that really breaks down the bill and helps us to be able to see what it's all about and the impact that it has. Resources that you can use or immediately go to. Breaking news, that's where I put the latest and greatest information. And also we are currently on Facebook. You can find us there and follow us. I've recently started publishing a monthly newsletter for our membership that I'd also like to share with you in a moment. But just a little bit about our conference. I mentioned earlier that we were having CMS join us. So the deputy director, we're so excited to be able to have Dr. Sy. We have a number of other presenters from CMS. Tuesday, we'll be hearing mostly from them. OSERS and OSEP are at the table with them. We're so thankful for their collaboration and we look forward to their joint messages. We have a Medicaid Academy that is for anyone that has questions about their implementation. And we are so thrilled to be able to have many practitioners on that panel that would be of great value to you. We have a practitioners panel, which includes people from school psychology, social work, nurses, people actively engaged in the work that are going to share what's going on with Medicaid in school in their specific areas. Other very engaging keynote speakers. We're going to have about 20 vendors present to share how they can help support you in your school districts and states. Of course, a lot of networking, a welcome reception, and we certainly have committee work. And if you are interested in joining a wonderful family-oriented, loving team, I'm telling you, a great supportive team on our leadership team that you would love to be in part of one of our committees, whether it's government affairs or membership or the activities committee or programming, we'd love to have you consider joining us and more actively participating with us. I'd like to take you to our NAME website. And I may have to, I do want to also make sure you have my information. My email is easy to remember. It's just executive-director@medicaidforeducation.org. Because please, I want to be a resource for you. If I don't know the answer, I'm going to help you find it or the right person to connect with. Steve, do you have anything else you'd like to add? I know I've gone several slides without stopping for you. If you want me to go back to anything, I can.
Oh, we're good. You do a very good job with this. And I just smile and nod along.
So I'd love to share with you guys. Jeremy, if you want to go first, I wanted to, if I had time, to share the website and where they can find resources.
I think that would be great, Jenny.
I'd love to.
And that would be a great segue. As you pull that site up, I want to remind people to put your questions into the chat. We really hope to answer some of your questions. We've got a few here that I think will foster a great discussion and a good dialogue with the remaining time that we have today.
Awesome. So this is our website, and I hope that y'all can see it well. And so we have just about in our leadership, you can see all of our how we're organized there, but I wanted you to see our events. And if you've ever heard of Dr. Adolph Brown, you know what an engaging presenter he is. And so we're going to welcome him to our conference this year. I wanted mostly though to point you to this. We have a lot of resources from our strategic partners, which are other nonprofit organizations. Like I mentioned earlier, the Healthy Students Promising Futures, or CASE, like Jeremy mentioned earlier, the Healthy Schools campaign that we often partner with. And under breaking news, you will find all of the act itself, which can be very overwhelming to read, but also much simpler, the one pager, the information that was released in the informational bulletins from CMS, also here. And then we have under trying to think about where we put, let me see, breaking news. And oh, there I am. I'm some breaking news. I wanted to share with you where my newsletter is. And then we will look at our, guess I've gotten lost in my own website. And so I apologize. And I could share it in a different way, but I'm sure sorry that I have not found it, but we can go ahead to those questions and answers.
Yeah, and if we have
I found
resources,
it. I found,
there it
goodness
is.
gracious, there it is. And so we have a journal that is Jenny's journal that we just released, a little bit about conference. We like to spotlight students and the success that students that receive our services benefit. And so this is a student spotlight from Houston County, Georgia, that we're thrilled to share, and other information that's going on as far as the organization itself, our long-term planning, and where we're going. And so we're excited at NAME to be able to partner with so many wonderful organizations. And Jeremy, thanks. So do we have some questions? I think you're muted.
I was talking and muted. Does
It
that,
happened.
does anyone have the mug that says you're muted? You know,
I need one.
that was the thing at the height of COVID when all of us were on Zoom 100
Right.
hours a week, the mug that just would hold up. But this has been such an incredible amount of content and information, and there's so much to unpack. I would love to do that with the two of you. And throughout, there were a few topics that we wanted to explore with you. The first one is, it goes back to the Safer Communities Act and the directive from to CMS. I'm curious if you can update us. Just, you shared so many different details and good things. I'm wondering if you could point this group into one of those files or one of the documents on your website that summarizes the most recent movement that is happening in Medicaid relative to that directive to CMS.
Right. The most recent thing they released would be the informational bulletin that I pulled up. That is the most current that we have, and that was August 18th. We do, and then probably the next thing that we're going to anticipate being released is that conference, because they have 3 or 4 presentations. And so that will be the next push. And then I don't know if we'll get another informational bulletin or not before the new guidance is actually released. But I know the next thing we should be receiving, I'm hoping we're going to be able to receive it. I don't know if they're going to allow public comment. They haven't said if they're going to post it and allow public comment or not. That might be something that, we can ask for at this time while they're forming it. But the next big thing is going to be the release of the updated guidance early next year. But that is the latest. That is the very latest that we have. So that's why we're so excited about conference.
Yeah. And Steve, you mentioned the difference between cost-based or fee-for-service based reimbursement, and you said that cost-based provides a larger reimbursement. And for those of us in the audience, we'd love to hear more detail about the differences there and what you think might happen with a cost-based reimbursement model moving forward.
So cost-based reimbursement provides for a lot more payment, mainly because you are able to allocate the salaries for the staffs that are on there, rather than trying to formulate a equitable rate for a particular code or service. A lot of times a staff person in your school that's providing services is doing a lot more than just, let's take personal care services individual. So a lot of the services they render are not an actual codable unit of service. You don't code somebody for watching a student to make sure if they're a risk fall. You don't have a code for service for watching that child to make sure they don't fall down. But that is a medical care that primary care services individual is providing for that student, which underneath cost-based reimbursement, because their salary when they're providing these services is able to be reimbursed. You can see where cost-based reimbursement ends up a little bit higher model than what a fee schedule would.
Yeah.
Setting
Absolutely.
both models, of course, I do fee schedules on a lot of my other provider types. So I've seen them both, and definitely cost-based reimbursement. I'm surprised in the past when CMS encouraged that, but state of Michigan, we tripled, more than tripled our reimbursement when we went to cost-based reimbursement. We went from somewhere around $20 million a year to $100 million a year just by implementing cost-based.
And do you see that that's where more states are moving? And do you anticipate?
Virtually, anybody who's went to cost-based reimbursement does not go back. We still have some fee schedule states out there that are looking into the expansion into there.
Yeah. Yeah. And so do you anticipate any of the pending directions next year or as a result of this Safer Communities Act to change how that cost-based or fee-based model works?
The biggest item is what Jenny's already emphasized, is that guidance that they're looking to put out, something to give states a better idea. Those who haven't already engaged fully in the program, it'll give them a better idea as to what's allowable, what the CMS is encouraging and driving at. And it sometimes helps auditors to know the direction to go when they come and look and audit a state, that this official guidance is actually official, and we can use it as groundwork in order to build our programs.
Yeah, that's good. And we appreciate the work you're doing at NAME. And I hear a lot from superintendents that they know they're leaving Medicaid dollars on the table. They know they're not capturing what is there for them to capture and fund the services that they need to fund. What would you say to a superintendent who makes that comment and says, "Oh, I know I'm leaving money on the table"? And this is for either of you, right? I hope
I
we
would
just have a
start
good
with,
discussion.
sure. I would start with, one of the facts I led with early in this presentation is that it is literally the third largest funding stream accessible to public schools. So why wouldn't you do it when you know that it can have that kind of impact?
What do you think does prevent, sorry, now I'm adding a question onto that, right? What do you think does prevent schools from capturing the Medicaid dollars that superintendents believe?
The administrative part of it, the busy work behind it, don't you think, Steve? The documenting, the setup.
Yeah, and there's sometimes the relationship between the state and the school can be antagonistic rather than cooperative.
Mm-hmm. So what kind of recommendations would you give to a superintendent or a district administrator who's sitting here with us and saying, I know I'm leaving money on the table. I know I have administrative struggles and I need to capture this. And as you think about that, I'm framing this from the perspective that there's either a cliff or an off-ramp, if you want to think of it as an off-ramp to the ESSER and ARP funds. And one of the big challenges is hiring FTE with that pending off-ramp, so to speak. Mm-hmm. And Medicaid is becoming a more important source. So what advice do we offer to these district administrators about how to take better advantage of these programs?
I can say a little bit. My first response most of the time is when I'm hearing an administrator complain about administrative burden as prohibiting them from expanding and doing more with the Medicaid.
Mhm.
I always lead with this, that you're leaving money and services on the table. That as somebody who works on the front line with getting services out, you are putting more students at risk by not pursuing the reimbursement, the full reimbursement. The more reimbursement you get, the more services you provide. Everybody knows that. You owe it to your students to seek that out. You really do.
Yeah.
You owe it to your community to seek that out rather than funding stuff through a local tax or other funding source.
Mhm.
Right. I'd agree. And Jeremy, the slide that where I referenced, the bottom line is minimizing that burden on the local district
On the local and
or,
state.
or
Yeah.
and so there are so many dollars that they can access through this route. And on top of that, the art money that you were talking about, the off ramp for, this is what I really feel like this is where the federal government is going to say, if you want that money to continue, you're going to have to tap these sources.
Yeah.
I have heard that. I have been told that multiple times while visiting DC. I was just there last week at the gala for the Committee for Education Funding, and that was specifically mentioned a few times. That there's money, but we're going to put it in certain specific areas like this.
Yeah, I agree with you. I've also had those same conversations with various parties that are really in tune with what's happening. And I do think that this is a long-term initiative. I really like what you said earlier on, Steve, which is this is about educating the options that we have. There are new guidelines, and we need to educate states and districts on how to leverage these sources. We need to build partnerships between the Medicaid and education offices, and the administration is a big barrier, maybe even just because of all the newness and opportunities that are coming out and not knowing fully how to take advantage of them. And I really appreciated the conversation about the expansion of coverage. And I think we can't overemphasize one of the points that you made, which is historically many states have restricted reimbursement to IEP-based services, whereas it's opened up, and you called that free care. I'm wondering if you could go back to that slide that you had, and I wanted to clarify, you said that the gray states are the ones who've adopted this, right?
They have either adopted it or they have applied for it. They're in the process of getting it. 17 states have implemented it to some degree.
Mhm.
All right. And so some states have only adopted it for nursing services, not
Mhm.
for everything like audiology, like I mentioned earlier. They're taking it a little slower. Some states have gone, all the way with it. And
Mhm.
so when I said we're all at a different place with Medicaid, I meant that.
You meant it.
It's true. This is a safe place to talk about where you are and, talk about where you can go next. We're just excited to finally be able to say that all 50 states are accessing these dollars in some form.
Mhm.
And I'll tell you, at the beginning of summer, there were only 16 states that were fully on as a free care state. We've added one just in the past month or two.
Mhm.
And then several of these states have just applied for it. But we went ahead and gave them credit since they applied for it, right?
Yeah.
So we need to work on those blue states being able to access the program to its fullest.
Mhm. Yeah, I think that that's an important step. And as we work in schools, sometimes there's a challenge implementing mental health services. So I want to just
Right.
branch out to the mental health arena a little bit, because
Okay.
oftentimes mental health is not an IEP based service. It depends, right, on the evaluation,
Right.
determination of eligibility. And we had a great webinar a couple months ago with the director of policy and advocacy at NASP. And what we were talking about is there are conversations around 504, and 504 possibly being an opportunity to expand mental health categories so that kids can receive accommodations and supports.
Mhm.
And obviously there's a lot of movement, but I think what we're facing as we're out there talking with districts is, how do you fund mental health for students who don't have it on an IEP? Or how do you fund mental health services if it's not in a 504 plan? And I
Right.
think that's an important conversation. I'm just curious if you have any insights for.
Yeah, this is the way
Yeah.
to do it.
Yeah.
It's specifically mentioned on that third page of that simplified version on the Bipartisan Safer Communities Act. This is the funding stream for that, to access mental health services through free care through these dollars. And so for any student, and let me clarify, that is for students who are enrolled in Medicaid or CHIP programs.
Right.
All right, not for every student. I know there are other ways that districts are working to close the gap of mental health needs of students, because I've seen it personally in some districts across the nation where they're applying for different grants and getting some curriculum in place for students, social emotional learning in place, so that we can all have a foundation for how to talk about our feelings and have some words that associate to that, right, during those formative years. But certainly mental health is on huge part of this conversation. And certainly this is the place to get the funding for that. And they're really encouraging telehealth services for that.
Yeah, I think that's a key. Is that there is opportunity to get funding for students on Medicaid or CHIP programs that
Right.
don't have an IEP, and that can help fund these programs. And I'm really glad that we're having this conversation, because it is a challenge for many districts. And so we could keep talking for a long time, I'm sure, but looking at the clock, we're really at the end of our time. And so I want to thank both of you for coming today and offering your expertise and your knowledge and sharing really good information with this community. We are going to share the recording and resources with everyone afterwards, so keep an eye out for information in an email. Jenny, can I ask you to go toward the end of this slide deck? There are a couple closing pieces of information. I think it's this next one. Yes, it is. There are some additional webinars coming up in the next 30 days. We have one with Dr. Shirley Dawson. She is an amazing person and a professor at, oh my gosh, I just lost the university up north in Utah. Weber State. I was thinking Utah State for some reason. And she'll come and talk to us about retention strategies that work. We also have Shauna Rader Kelly, who's going to talk to us about Tier 1. What is it? How do we do it? We encourage you to register for these webinars, attend, and then if you can't attend, you're at least going to get distribution of recordings and materials. And then one last slide here, if you can go one more. We want to remind you that we'd love to meet with you. Schedule a consultation with us by visiting that link or scanning that QR code, and we'll donate $50 to NAMI. We want everyone to feel like you've got an opportunity to be part of this community, to learn, to contribute, to ask questions. So keep engaging, and let's keep the conversation going. Thank you again, everyone, for coming, and we hope you have a great day. Bye-bye.